Hi, I'm Mark Trollis. Today I wanted to talk with you about protecting your fertility. This is something that is not very commonly discussed and very important. There are different areas to address in trying to preserve your fertility, and that you can do from a very young age. The areas that we can discuss are cigarette smoking, sexually transmitted infections, weight, and also waiting too long to conceive. Now, the first, cigarette smoking. Probably one of the worst things that a woman can do is prolonged cigarette smoking, because it actually accelerates the ovarian aging. Women who smoke actually go into menopause earlier than women who do not, and they're experiencing more fertility problems. Regarding sexually transmitted infections, if you have unprotected intercourse, which means not using a barrier for contraception, you're at risk for a sexually transmitted infection called chlamydia or even gonorrhea, and you don't always know that you've acquired this. The consequences could be tubal blockage and or pelvic adhesions, and that prevents the ability of the sperm and the egg to meet inside the fallopian tube and create an embryo. Another way to protect your fertility is to have a healthy body weight. As a matter of fact, being too thin as well as being too overweight both can have effect on your ovulation function and your ability to conceive, as well as carrying a successful pregnancy. Another very important issue in protecting your fertility is actually a woman's age. Commonly not realized by many women, she is born with all of the eggs she's ever going to have. 1 to 2 million at birth, 200 to 400,000 when you've gone through puberty. So you've lost hundreds every single month when you go through a cycle. That happens whether you're on birth control pills and even whether you're pregnant. So by the time a woman tries to conceive, whatever age she is, that's about the age that your eggs are. For example, if you're 33 years of age and you want to try to get pregnant, your eggs are 33 years of age, you've lost lots of eggs, so that's actually about the age that the decline in fertility begins. The best thing to do to protect your fertility is probably look into conceiving, if possible, in your mid to late 20s, and not much later than your early 30s. Getting past that will decline your fertility. Egg donation is a very, very exciting and successful method of conceiving. We use it when a woman is experiencing severe ovarian aging, meaning that her egg number and quality are just unfortunately too poor to give her an optimal chance of having a child. So what we do with egg donation is that we actually use another woman's eggs. This is a donor that's less than age 30, typically anonymous or known to the woman, and the woman actually gets stimulated to produce multiple eggs. Now, the recipient, who is the patient, has her uterus being prepared with natural hormones. And then when the time of synchronizing the cycles occur, the egg donor's eggs are removed, inseminated with the recipient's partner's sperm. Now embryos are formed in our laboratory and then timed and transferred into the woman. The pregnancy success rate is significantly higher than the usual success of a woman using their own eggs. So we offer that here for patients with significant ovarian aging, either with someone that they know or an anonymous egg donor. Someone that is interested in donating their eggs can simply fill out the forms on our website or call our office. And we are very, very grateful for you giving this gift of life. We have a coordinator that will walk you through the process from start to finish, and explain to you exactly what's going to occur every step of the way. It involves hormonal medication, some injections, and actually ultimately an egg retrieval procedure that is done right in our office under sedation, and it takes less than a half hour. You'll go home the same day and back to work usually the next day. Now, the side effects and risks of a procedure like this, often the medications, you might get a little bit of nausea, some breast tenderness, possibly mood swings. The actual risks of the medication, the most serious one is getting overstimulated, which rarely would cause hospitalization and even more serious consequences. We monitor you very closely to ensure in every way that you are cared for safely during your entire cycle. And we are very, very grateful that you're offering this gift to our patients. All of our egg donors are screened prior to a cycle to ensure adequate health for the recipient couple. And what is screened? Well, we do a psychological background, we do a drug screen, certainly a complete medical history and physical, and we follow the Food and Drug Administration guidelines for infectious disease screening, including HIV. Embryo donation is another exciting area of third-party reproduction. And this involves couples who are trying to conceive by using embryos from other couples who have gone through in vitro fertilization and have now generously donated their embryos. So we prepare the woman to receive the embryos by giving her natural hormones to build up her lining, and then they will thaw the embryos that have been frozen, and we synchronize the transfer of those embryos into her uterus. Embryos right now can be frozen for an unlimited period of time, but the longest has been approximately 12 years currently. Fertility Care offers this and all other aspects of third-party reproduction.